We are.
Well, welcome once again to Calaveras Living. Actually, our guests are already talking. They know each other well, but I'll tell you about that a little later. Things are happening at Mark Twain Medical Center, some innovative ideas and a new program that gives more service to patients, and that's really the purpose of the whole hospital. In fact, I'll bet some of you wonder if that's really the purpose of some doctors and hospitals where you don't get good service, but I think they're doing their best out there to really service the patients and give them the care that they deserve and want. So today we're going to talk with Dr. Randy Smart and nurse Marcia Temple, and they're working on a new program that's called Telehealth, and it's good to see you both.
Good to see you, John.
Thank you for
goofing off there before the show. But anyway, telehealth. And you're going to be in charge of it, Marcia?
Yes, that's correct.
How did that come about?
The clinic was opened several months ago. We created this opportunity for patients to come in from a rural area, such as here in Calaveras County, and receive care right here in their home, right in their area where they live. The doctors are basically via robot, and the program was created by the district health, funded partly Dr. Smart.
Right, about 2 years ago, John, I became a member, I was elected a member of the district healthcare board, and one of the things I really was passionate about is the idea of bringing healthcare services to our patients and citizens of Calaveras. And I was aware of this robotic technology, video technology from some other programs. And so I proposed that the healthcare board establish a consultation program for our patients that wouldn't normally have access to this particular kind of care. And one of the things we really got excited about are patients who have trouble breathing. And trouble breathing is an awful symptom.
I've gone through it, so
yes. And so many of those patients are normally managed by pulmonologists, and so we connected with some partners in Sacramento that had robotic technology and had pulmonologists, and we said, look, how about if we set up this clinic in Calaveras? The pulmonologist can see these breathing patients and help them. And everything really gelled, and we realized probably the most important element of the program was to get a skilled coordinator to run the program.
Okay.
And so we went out and looked, knowing we would need a nurse, probably a nurse practitioner, and we found Marcia, and we hired her, and she now runs that program.
Okay, now you both mentioned the word clinic. Is this a separate building from the hospital, or this is all remote?
Yes, it's a separate building.
Okay, near the hospital?
Yes, it's on the property of the hospital. It's at the Family Medical Center in San Andreas.
Okay, so, and you're basically servicing people who are not there, or they come there?
The patients would come to the clinic, and we'd provide care for them there at the San Andreas Family Medical Center.
But you would use sometimes as your source someone at a remote location, like a pulmonologist or somebody in a specialty, right?
Correct. They would come into the appointment, and I would start the process of the evaluation, assessment, gathering history of present illness. I would basically start their appointment. And when we reached the point of the appointment time, the doctors would beam in on the robot, and a board-certified pulmonologist would come on, which is also our ICU intensivist, and they would go over all of the patient's information and do their similar appointment as if they were physically in the office. I would assist with auscultation of the heart and the lungs. I would basically be the doctor's hands. They can hear everything that happens. They can hear the breathing, everything, the heart. It's a really wonderful opportunity for patients to come right local and get care.
The remote doctor then sees everything on the robot video.
Correct. They could even have the capability of doing split screen, looking at images and discussing it with the patients, saying, I see that you've had a chest CT scan, and this is what I have identified, and this is what we want to do in terms of your direction of care. So yes, the doctors are there live on the robot, correct.
Okay, and any testing that has to be done, it would be done where you are.
Yes, I order
And then
the
the results
testing.
would go to the doctor or maybe ahead of time.
Correct. The testing is performed there at Mark Twain, and we basically notify the provider when the testing is available in terms of the results. I help to facilitate. We communicate, and then we let the patients know basically, this is our findings, this is what we'd like to do, and we're going to continue the same direction of care. We'd like to make some changes, have additional testing. How do you feel about this? Does this treatment plan work for you? What are your thoughts? Is this something that you'd be able to follow? How can we help you at this point? And they're 5 miles, 10 miles, they're back at home versus driving a couple of hours or waiting a few months to see someone of this level specialty.
How did you go about, or you, or either one of you, probably you, Marcia, go about locating the proper doctors in certain specialties within what radius?
Well, Dignity Health has a telehealth network of providers, doctors that are a part of the robotics and a part of use of the robot. These doctors, Dr. Smart, perhaps you can explain a little more.
Right.
A little more detail.
Well, there are several elements to that. One of the most important things we wanted to do is we wanted to target a patient population that is really having trouble and doesn't have access. And so one of the most important groups of patients are patients who are readmitted to hospitals again and again. And for us, we feel like if they keep coming back again and again, somehow we're not doing things as well as we could. We need to do more. And somehow we haven't been able to provide that. So what a hospital like Mark Twain Hospital can actually look at who comes back most. Is it a cardiac patient or a respiratory patient or a stroke patient? And it turns out our highest readmission rates were with the patients who have breathing problems, primarily emphysema and bronchitis. And so when we realized that, we partnered with the Mark Twain Hospital. We said, look, let's work together on this. Let's take these breathing patients that keep coming back. Let's get them into Marcia's clinic. Let's get the pulmonologist to help them because we certainly don't have that here. And what we hope to show soon is that those readmission rates are improved, right, and are dropping. And I think we will show that.
But conceptually, this all came together through, I mean, your ideas or who's?
A combination of people, John. I think I started this. I have a colleague in Sacramento, Jim Roxburgh, and Jim is the manager of the Telehealth Network. Craig Marks at the Mark Twain Hospital jumped in. He understood this and liked it. And the District Healthcare Board immediately funded it. They funded it in one meeting. And then Marcia has been so great because she brings these ideas right from the patient care point, where she looks at the patients, she does the appointments, and she says, look, we can do even better. Let's change this, or let's provide that. And so it's really a group of people that I think have passion and don't ever want to see anybody short of breath.
Yeah.
And we're convinced we can help them.
Yeah.
Okay, and you've branched out past the pulmonary aspect. Are you zeroing in on other things that have been occurring or recurring, shall we say, at the hospital that might be the next step?
You know, John, one thing I've learned about myself is I always have a next step. There's always more I want to do. And this is the start, I think, of a much bigger program. And Marcia can talk to this some. I foresee other services that we wouldn't normally get here. But even a step further is, what if we can take this care into the patient's home?
Yes.
And she can do that. What if you can take these robots into a home for the person who's on oxygen or doesn't have a car or doesn't have transportation? And if you can start doing that kind of care, it would be huge. It would, for patients and families, and that's my vision. And I think hopefully you and I will be sitting here in 10 years talking about that. And that's what we'll be doing.
I'll be short of breath.
You will not, because
We'll have you in our clinic.
We'll have you in Marcia's clinic.
You'll be here to help.
I'll be here to take
now,
care
what's
of
your
you.
background, Marcia, in Where had you worked in hospitals or for doctors or?
Yes, actually both. I worked med-surg for about 13 years, which was the position I was in prior to entering graduate school, getting the nurse practitioner. And before that, I did 5 years in rheumatology. Prior to that, sports medicine. And I did 10 years in the military, regular Army and then California National Guard. So my entrance into medicine, nursing was with the military. I entered as a medic, came out a nurse. And it's been nonstop ever since, one step after the next.
Did you serve in this country or overseas?
This country and overseas. I lived in Germany for 2 years.
Oh, that is interesting. What do you envision, as Dr. Smart says, as the clinic expands, what would be kind of a logical next step, besides not just going to their homes, but as far as diseases go or maladies?
Excuse me. I foresee our next, in this particular case, I would say I foresee our next service line as being, for example, neurology, working on patients that have chronic debilitating disorders, working to help them, give them some more care here at home, better quality of life, offer the services that they need. But to me, I am right now more focused on the quality of service, the quality of care. It's not just about going into a clinic and having an appointment and leaving with paperwork. Our patients are there and they often can't go that next step. How are they going to walk to the hospital to get a chest x-ray? We need to make systems that work. So we are in the process of creating a system where our patients can have that next step. We need to identify what those needs are for each patient. Spend that time, get to know them, and move forward. So my thought is that if we can help this greater population, patients that have neurological health concerns, then we have tapped into another area. Then there's thoracic surgery. There are many service lines, but the question is, where's the need? What does the hospital identify as being one of our primary concerns? Where are our higher readmissions? What can we do to help this population, re-empower them, and have them look at things a little differently, and basically lead the path for their own health? What's going to allow them to be, in so many words, compliant? And how can we give them the tools? What are the tools?
Do you have someone to help you, or are you pretty much the clinic?
Yeah, there we are.
He's too expensive.
She is the
You're right
clinic.
about that.
She is the clinic.
Okay.
It's me.
But eventually, I mean, you'll have someone to, who does the scheduling for you and everything, or you do that?
No, I look over, I do the scheduling there. And before, it was very easy to say, well, you know, we could pass that and let that be done by someone. But when you're scheduling a patient that has specific needs in a specialty clinic, there's certain things that need to be identified before that patient is seen and during the visit. So if you're coming in to see us, I could have had certain testing done prior to. I want you to come in with getting results. You need answers. You don't need to hear, come back in a week or a couple of days with the results. So my goal is, if you're coming to us, I'm going to identify where all of the gaps are in your imaging, diagnostic testing, provide you the services you need, the documents, and help you get to where you need to be, so that when you come back, we're able to say, this is what we've identified. Let's go from here.
Is it even possible some days that they can have the testing and an appointment with you at the same time?
It depends on the type of testing.
Okay.
Yeah, it really depends. I'm in the process of attempting to link our appointments with radiology, so that on the day that the patient is seen, if there's something that's ordered, I'm able to say, we have a space for you, let's get you up to the hospital.
Yeah, because when you talk about people getting to the hospital, I mean, if they have to come back and back, it defeats the purpose that you were talking about earlier about people who do come back and back.
And this is a part of servicing, taking care of our patients at a different level, a higher level, a closer relationship, where if I know that the chances of them having the testing and blood work done is whatever the percentage is, what is my role in making it so that that patient could actually get everything done that we need, and not just have them out there trying to figure it out. I need to be able to assist. So we're working on this.
So far, how long has the whole thing been in operation?
Not very long. We started it about the middle of last year. We wanted to start a little bit slowly because we didn't want to trip.
You got to see it develop.
Right. We wanted to learn, but learn quickly. And I'll tell you, I am so excited about this. So we decided that we would try one clinic a month. to work out the bugs and to understand what we were doing better. And that lasted about a week. and then,
Yeah, that's a long time.
and then Marcia called me and said, Doc, we need to do more. We have patients, how about twice a month? And so we did that, and she called back and she said, what would you think about 3 times a month? And so we're just about to every week.
Oh, that's right.
And
A day a week, you mean? Or the full
it's
week?
kind of a day a week. It's about 6, 8 patients once a week.
Yes.
But the other thing I will never forget is, so I was a little bit nervous about this. We're kind of charting new territory, and and so the first day came last year, and I'm anxious, and I want to know how it's going, and I know I have to wait, and I know she's busy, and I'm not there. And finally, the day finishes, and I call her, and I said, "Are you okay?" She goes, "Yep." And I said, "How did it go?" And it's quiet for a minute. She says, "They loved it."
Yeah.
Wow.
Very well received. Absolutely.
Okay, when you
loved
say
it.
they, the patients,
Yes.
right? Okay.
Yes.
What are some reactions you hear?
Patients are happy that they have, first of all, opportunity to be in front of a robot. They've heard about this type of clinical service
Yes.
from in the community. They love the fact that they have a specialist that is right here in their town. Most often, they're within 5 to 10 miles from here. They have a provider that's in the room with them, and they could just basically relax and say, wow, this isn't very hard.
Yeah.
It's always fascinating. I have had more hugs since starting this clinic than ever before. Patients are very happy.
Wow.
Very happy.
I think at first they're a little bit suspicious, like it might be too gimmicky, or
Yeah.
it's an
Or
experiment.
do they say sometimes it might be too expensive?
It's just they're not sure exactly what they're getting
Okay.
into, I think they come into it a little bit cautious, and they kind of look at the screen and they think, and then they realize, wait, this is a real doctor,
Yeah.
and it really takes an instant to where
Yeah.
there's just total open communication.
When it goes back to what I was kind of inferring there, is it less expensive or more expensive than actually going to where that doctor might be?
Right. So the financial piece of this is not worked out very well. And that doesn't represent any problem for the patient. It represents more a problem for the sponsoring organization. For the patient, it's cost neutral, meaning they don't pay more. Their insurance does get billed to some extent. But the interesting thing, John, and this is where I really feel like a pioneer, is what Marcia is doing is way ahead of any kind of regulatory guidance or financial program.
So you make your own rules kind of as it goes, or they develop?
Well, we kind of wait for them to make them,
Okay.
and they're not making them real fast. But we basically, one of the biggest insurers in the world is Medicare, CMS. And Medicare and CMS are still trying to figure this out. And you would realize that the majority of this kind of care is going to be Medicare. It's going to be people over
Yes.
65. But the reimbursement rates and the payment fees and the methodology is completely on the table in somewhere other than Calaveras County. And that's where I really have to thank the Mark Twain Hospital and the district board, because they are paying Marcia's salary, they're paying for room, they're paying for equipment, realizing that the reimbursement probably isn't going to be there. It's truly a service to the community.
So it'll be a loss factor for a while, perhaps.
I think so.
Okay.
I think so. But it's not a loss for the community. And,
Oh, no.
and when you look at the idea of readmissions to a hospital, I mean, what do those cost? Those cost lots of money. And I think the insurers will realize this. So, if my patient has this kind of discharge support, like my patient is in the hospital, can't breathe, Marcia engages while they're still in the hospital,
right.
Yeah.
transitions them into this clinic. it'll take them a very short period of time to realize they're saving lots and lots of money, because every time you readmit the patient, thousands,
Yes.
thousands. And it won't take them long to realize that.
Good. Now, getting to something you kind of had some vision. You were mentioning earlier that eventually you might be able to take a robot out to someone's home. What are the expenses there? I mean, is that easy to do? Difficult to do?
The logistics are actually pretty easy. It's as easy as taking a smartphone into a home.
Oh.
The technology is there. It's not a big wheelable robot like we would use in Marcia's clinic. It's a more compact version, but certainly much more than a smartphone. And if that is a technology right now she could bring into anybody's home.
Mm-hmm. They are portable, or do they roll?
They are portable. They're as portable as a briefcase.
Oh, okay.
And I actually think we will see more medicine like that, not so much in her project, which is telehealth, but the idea of there are many of my patients that are homebound.
Yeah.
Mm-hmm.
They're old, they're sick, they're terrific people, but they cannot get to the office. And so currently I go to their home, but it would be very easy to transition to me if I had somebody like Marcia who could go to the home. Then I could be at the hub and see house calls frequently through that kind of technology.
Now, the robot works off satellite, or how does it work?
It works off a Wi-Fi kind of, so it is. So within a building, there Wi-Fi is a kind of an internet connection, and so that Wi-Fi is then connected to fiber optic cables that ultimately go all the way to Sacramento and San Francisco and all over the world.
Okay, but ultimately at someone's house, they would have to be hooked up to something, right?
And that could be done through satellite.
Oh, okay.
Right. That could be. It was interesting. I saw a presentation about this a couple of years ago in Santa Barbara by the engineers that were designing this, and they actually were able to go to the Bolivia and go up into the high Andes, into some of the tribal areas of the high Andes, and they were actually doing perinatal care, obstetric type care for women that were pregnant and going to have babies and were having complications. And what they could do is they could send their assistant up into the Andes with the technology, and then the perinatologist or obstetrics doctor would be back in Toronto or LA and see these patients, do ultrasounds, provide care in the high Andes.
Wow.
And that was all done through satellite. And
If you get over in the Andes, we'll do a show, okay? Well, you really have to be, well, of course, I think all nurses or doctors, too, they have to be very versatile in adapting to their patients' attitudes and fears or joys or whatever it is. So given this, you have a real challenge.
Yes, it is. The first few minutes of the appointment, yes, is a little bit nerve-wracking for patients, but I sit side by side and have a conversation with them about what the visit will basically, what will occur in the visit.
Yeah.
And just our conversation and being within a foot of the person, they relax. I just sit and chat with them. I want to get to know them. I want to understand the individual before I go into the appointment. And it's usually fine within the minute of the doctor beaming in. It's almost as if the doctor's standing right in front of them. They're very relaxed and like, oh my gosh, that was so easy. I was nervous. Everything's fine.
Well,
So yeah,
good.
you do have to adjust to the personalities.
Yeah, and of course, you have to explain the equipment a little bit, right? Just
Yes,
what's
because the
gonna
robot
happen.
moves, absolutely.
Yeah.
It has the capability of moving, zooming, yes, absolutely, and the attachments to it, yes.
I guess
do.
mostly now pulmonary things. You haven't dealt with any young people yet, have you?
Pediatrics, you're referring to young people?
Well, I mean,
Early
when you're talking
20s
about
or-
pulmonary things, I'm talking about working just with younger people in this type of a setting. It's mostly older people.
Actually, yes, we do have a young patient population, yes. You know, or I would say mid-20s on up.
Oh, okay.
Not very many, but
Because
yes,
I would
we
think
do.
some of the young people
Oh, they
down the road,
love
they're
it.
just fascinated by
Yes,
it.
they love it. Absolutely.
That's really good.
Yeah, it is.
Now, in the remaining time that we have, what haven't we covered? Can people, is it listed in the, like, yellow pages or the phone book, or they can call the main number and ask for the clinic?
Access.
Yes, absolutely. We're not listed as yet in the yellow pages, but calling Mark Twain and ask for the pulmonology clinic or the pulmonology telehealth or the robotics nurse or Marcia or
Okay.
the specialty nurse with the robot, either, any of those, the breathing nurse,
Okay.
they get me.
But
They
I
get
mean,
my desk and I answer the
The
phone.
whole idea of telehealth is becoming known.
Absolutely. Before it was less so, but now, absolutely, it's more commonly known
Oh, that's
in the
good.
community, which is the wonderful part.
Oh, it sure is. Now, what other things haven't we covered, Doctor, that are important?
Well, one of the things we were excited about is this is a population that is dependent on supplemental oxygen. And so if you get an oxygen tank and you put it in a car and you drive to Sacramento, you run out of oxygen. And that's one of the many barriers that these patients face, is you just can't get to the appointment without suffering. And many of them can't drive anyway because of their emphysema and bronchitis. So it's a patient population that doesn't have any alternatives. And I'm really excited about it. I'm excited that they're going to get the opportunity. And there's still lots of work to do, but I really hope the listeners, you know, that if they have loved ones, families, or neighbors that are suffering from emphysema or bronchitis or a breathing disorder, that they contact the hospital or they contact their healthcare provider to find out if they can be seen in this clinic. And our policy now is that any healthcare provider, it's not restricted in any way, any healthcare provider can refer these patients into Marcia's clinic.
Okay, good. Boy, thanks to both of you. And of course, you see this
you.
expanding into other maladies, right?
Hopefully tomorrow.
She'll call you up and say,
Yeah.
I'm doing great.
She's already done it. She's already
I'm in the
done it.
Andes.
Yeah, I'm in the Andes, and call and collect. Okay. But Marcia Temple, she's here. She's in charge of the clinic, and of course, Dr. Smart has his own private practice in Murphy's, and does a number of things with Mark Twain to help them out with ideas like this.
Yes, sir.
So, doctors, good to see you.
Good to see you,
Good to
John.
meet you.
Nice to meet you. Thank you for having
And
us.
hope you'll come back and tell us the progress.
Looking forward to it.
Okay.
Thank
Well,
you.
that's it, and we'll see you next time on Calaveras Living. Thank you.